Hi, Nursing 6818. Dr. Kim Paxton here. Welcome back to Health Promotion and Prevention. This is week number 2. First, thank you for all of your hard work and great posts from last week. There was some amazing information that was shared in those postings and your responses. Some high levels of critical thinking, critical analysis, and group discussion. Great pictures that you all shared. One of the elements that really came across strongly to me is that each of you, in some means or manner, has been exposed to professional bias that may have occurred. And I'm hoping that by your engaging in it through this discussion, you're able to gain a better understanding or a stronger perspective on how important it is for us to put aside our own personal values and beliefs and focus on what is necessary for our patient to achieve a positive health outcome. So this week we're going to be looking at the environment, the community, and how this connects into your individual, their family, and back into them. For week number 2, your objectives are pretty simple. I'm going to ask you to be able to define out what health is from a family perspective, community perspective, and then relate that back to the individual. I'd like you to be able to identify the influences within a community and environment that can affect the health of an individual and how you work to develop a plan of care for them in relationship to promoting their health or preventing a disease process. I'm hoping that you'll be able to explain that there is an interconnectedness that occurs between the individual, the family, the environment, and the community, and how all these are mediated into the health of the individual. You're going to be gaining understanding about systems thinking and systems theory, and these have to do with change behavior theories. And as you're going over these and reviewing these, I'm hoping that you find one that actually resonates with you and you kind of hold it close to your heart because these will come up again in the program when you do your comps. And then are you able to identify the factors of health that are related to the built environment? And in just a few minutes, we'll talk a little bit more about what a built environment it is, but how those affect the family, the community, and then come back to affect the individual. This week, you have a couple of readings. You have two different chapters in Edelman that you'll be reading, Chapter 7 and Chapter 8. One of the key elements that you're going to see carried over from Chapter 7 and Chapter 8 is a functional health patterns as brought forward by the theorist Gordon. You see it in Chapter 7 from the family perspective, and then in Chapter 8 you see it come back over with respect to those functional patterns as they apply to a community. So the readings in these two chapters are going to help give you this foundation. And remember that everything that happens in the family and in the community and in the environment is going to come back and have an effect on that individual. The other reading that you have under family is an article by Lloyd. This is a really good article. It's not too long. What you're actually seeing in this article are the influences of the family on the behavior and health of an individual, and this one here happens to be children and their adiposity. You have two chapters by Pender, Chapter 3 and Chapter 13, and these relate to community. You're going to see some really interesting theories brought forward, but then you're also going to see how they're applied to work with health promotion plans in the community to give you a perspective. One video this week, and that is on family health promotion, and you're going to see how this all interrelates. Under the supplemental reading, there is one called Proceed model. I would really encourage you to go on this link and scroll on down to actually come to the model. The model helps to give you a visual perspective of how the elements come together and have influences on health, and how if you do certain interventions at certain points, they can alter behavior and improve health. I think it's an important one for you to gain an understanding of visually because it helps you to understand more from a theoretical perspective that health component and influences, and then how you can intercede into them. The built environment, I have a video for you to watch related to this. This is a really good video. It helps you understand how our environment, the environment that is built around us, actually affects our health, impedes our health, and promotes our health. Now, the built environment has numerous components to it. It's not just the buildings around me,
but it's what I hear, it's how I engage in social media, it's what I'm watching on television, it's the industry around me, it's a lot of elements. So the video really helps to give you a broader perspective of how this built environment actually influences the community, then the family, then the individual. I have a link here to theories of behavior change. This is important for you to review, as several of these theories are ones that help you as the nurse practitioner understand the influences of health and the attainment of health of a patient. When I, as a nurse practitioner, am working with a patient and I'm trying to figure out the whys, why are they doing this? Why is their behavior like this? Why am I not being effective in the plan that I'm setting forward? These help me to see it from the patient's view and helps me to plan differently. So sometimes I'll start with one theory and it may not work, so I may change to another because it's more in line with that patient. These theories also are ones that you may potentially want to utilize for your comps, because in your comps you need to identify theory that you will utilize to demonstrate that you're able to integrate a theory into practice. So I would hold these close, and especially if you find one that resonates with you, keep that one or mark it down someplace so you can come back to it. I'm asking you to go on the internet and take a look under Google search about what is a built environment. You're going to see a lot of different dynamics, and the reason I'm having you do this is because a built environment changes depending upon where you are and what your region is. So we're here in Colorado, but I'll tell you in the Midwest, the built environment is very different than it is here in the Colorado region. And again, it's even more different if you head to the West Coast. So how does it change and how does it influence people and their values and their beliefs in relationship to health? This is really important to gain an understanding of, again, because it goes back into the elements that interplay into your patient. I have a video for you to watch. It's a last one on this particular page, and it's a socio-ecological model. It explains to you how the economics and the social structure interplay into values and beliefs of an individual, and then the care that you as the provider assist in planning out for this individual. It's very short, but it also helps again to get that foundation into you and hopefully plant seeds that you'll be able to use later in your practice. Your discussion this week is going to be based upon the readings and the videos, same as last week. There's one particular question, which is question number 3, that is a clinical reasoning, critical thinking piece that is demonstrating to me your translation of what you've been reading actually into a manner that allows me to assess how well you were able to learn this information. I would really encourage you for question number 3 to utilize some form of a citation from a reading, maybe a video, maybe from the Google search that you did on the environments, but something that demonstrates to me that you're making this tie-in strongly. For this particular discussion, it will be due on Wednesday at 23:59 p.m. and the rest of your discussions and your CLTs will also, your initial post is due at that time, and your final one for response to your individuals in your groups is due on Sunday. Your major assignment this week is something called Scope of My Community. This is kind of a modified windshield survey, which you may or may not have done in your undergraduate program. There are 2 different elements to this. As you begin looking over the instructions, you're going to see part 1, which are questions I'm asking you to think about as you begin this process. These questions are going to appear on the template that I provide you to put your data on when you do your collection as you drive through your communities. So you don't have to answer them right now. They will actually be on your survey template and you will answer them on the template. The purpose of this windshield survey is to help you get an understanding of really what is the composite of your community. How does your community help support health? How does your community impede health? As nurse practitioners, as I've written, it's really important for me to be knowledgeable of what is in my community, what's available for me to refer my patients to, what gaps do I have in my community that I may need to refer them out to, which could then impede outcome or retard the ability for them to engage in healthy practices. For this particular assignment, you are going to need to be driving your neighborhoods. I'm asking for you to use a 10-mile radius from your home. Some of you live in some fairly large rural areas, and you had indicated to me via communication that it's pretty hard to get to my whole community. And you're absolutely right. So let's make it a 10-mile radius from your home. In order for you to really gain a perspective, I would highly promote that you be the co-pilot and not the driver as you drive through the community. That way you're able to go ahead and write things down as you're seeing them. You will be graded on this assignment, and what you're being graded on is the completeness of the data that you are writing down for each of the elements that I'm asking for you to assess. Last week we learned about personal bias, so I really want to make sure that as you're writing this to me, that you are showing me an absence of assumptions, that you're not using any judgmental terms or global generalities, that you're just demonstrating what is in your verbiage. To access the template, you will go ahead and click on the blue highlighted words as you see on the screen under the process. This will open up a document that you can save as a Word document on your computer. You can download it also, and each of the elements that I'm asking you to assess are on the template. You have questions that you will answer after you complete the data search in your neighborhood, and there's 6 of them altogether. The first 3 that you saw under the beginning part of the instructions, and then 3 more after you complete those. The last 3 questions have to do with the county health rankings and roadmap section. This is a website that actually demonstrates to you how your community has ranked on a national level. As you're getting your data collection together through your windshield drive, please make sure that you're only documenting what you are seeing, hearing, and smelling through the windows and windshield of your vehicle. Of course, you can't smell through the windshield, so that would be with the windows open. After you complete the survey, you will finish up with answering the questions. Your document will be uploaded to the survey link, and what you're going to be submitting is just that one document, which is your windshield survey template. On that template, you will have your windshield survey data, the answers to the first questions you saw on the instructions, and the answers to the questions of the final questions that you see here under number 5. So all of these are on your windshield survey template. The template looks like this. So the different types of categories that I'm asking you to look at in your community are the boundaries of your community, and I've given you clear direction of what is actually there that I'm looking for: housing and zoning, space, types of stores, transportation, human service centers, people in the community, industries, and protective services. For some of these, I have put in parentheses that you may need to use the internet. And the reason for that is these services may be present in your community, but they're not within a 10-mile radius of your home. For that, you'd have to look on the internet then, just to make sure that you had the data for that community. If you had to do that and you did not find these things within a 10-mile radius of your home, this is something to indicate as a gap. And that would be something that you would put down for questions that are occurring on the last page. After you complete your data input in the chart, you'll answer the 3 questions that you had originally seen start off the instructions. As you can see on this template, at the very bottom of page number 2, it says more questions on the last page. Please don't forget to answer those questions. Those questions are the same ones you saw under number 5 on the instruction sheet. Please make sure you're being very clear and explicit. And if I'm asking you to explain your response, please make sure that you're doing so. You're not just saying, yep, I saw everything on my windshield survey, kind of correlates to the rank. That's not enough. You need to be very explicit. In ending the overview for this week, I'm going to leave you with a quote. A joyful life is an individual creation that cannot be copied from a recipe. As you did your learnings from last week and this week, this is very poignant in that my joyful life may not be another person's joyful life. And that as we help people create the recipes to have a joyful life and a healthy life, it's not going to be the same for every single individual, and it may not mirror what I believe it is. Have a great week. I'll see you online virtually.